Hello， 各位观众，大家好，欢迎收看 James on Air， 我是 James。上一次 James on Air， 我们邀请到花莲慈济医院中医部的林仪
invited Dr. Lin from Hualien to talk about Chinese medicine and how we export Chinese medicine to foreign countries. And today, the topic of this episode is the distance between your eyes and bad vision. And I believe that because of the pandemic, your eyes has been on the screen for even longer. Would you often feel that your eyes are dry and uncomfortable? Today, we're going to take you to defeat bad eyesight and pay attention to the industrial development of related industries. Taiwan has many ophthalmology-related medical materials and products that are well known internationally. We would like to welcome all of you to interact with us. According to statistics, global internet users around the world spend an average of 6.5 hours on the internet every day. In Taiwan, people use their mobile phones for as much as 9.4 hours a day. Please take a look at these charts. As you can see, the myopia of children in Taiwan is far higher than the world average. 70% of children in the elementary school have myopia, and about 1/3 of middle school students have myopia of more than 500 degrees. In addition, the global population of elderly people continues to rise, causing the decline of eye function and rapid increase in the population with diseases. These are problems that cannot be ignored. Therefore, market research data shows that the global ophthalmology medical material market will continue to expand and reaching $58.4 billion by 2023, with a compound annual growth rate of 3.5%. Today, we're very honored and happy to have invited a well-known ophthalmologist today. He's professor of ophthalmology at Chang Gung University, the superintendent of Keelung Chang Gung Memorial Hospital, and the chairman of the Asia-Pacific Society of Vitreoretinal Medicine. He's also an international renowned expert in macular degeneration and cataract surgery. He has published many important academic papers and won numerous awards. He's also the editor and reviewer of international medical journals. Let's welcome Dr. Lai, superintendent of Keelung Chang Gung Memorial Hospital. Thank you very much. Would like to thank Taitra and James for the invitation. I'm very happy and honored to be here at James on Air to share with you about ophthalmologies and how our products can help the world. Thank you. Would like to take this opportunity to talk about things about our eyes. As mentioned earlier, the myopia problem of children and adolescents in Taiwan is truly serious. Now, when I walk on the streets, I can see many young people. They're playing with their phones while walking. So, at work, we look at our computers, and we go home, we still look at these screens. Even when we commute, when we're on the MRT, or when we walk, we're still playing with our phones. So the eye problem seems to become more and more serious. So my questions to Dr. Lai. For these kind of diseases related to the eye, especially myopia, how can we prevent these diseases? Or what can we do against myopia? For example, my 3 children all have myopia. When they were little children, my doctor suggests them to use metrioptics. However, if we for treatments like long-term atropine application, does it have any side effects on the eyes? And what high-quality products does Taiwan have in this regard to help people prevent from myopia? Thank you for these questions. Ever since the popularity and invention of smartphone and tablets, I think whether for children or For middle-aged people or even elderly, we spend a lot of time with smartphones and tablets. If our eyes stare at tablets or smartphone for long hours, it will cause the eyes to get dry or tired. Usually, you will blink less when you look at the smartphones and or tablets. So that is what we see a lot in our clinic. Actually, in Taiwan, we have a lot of products that can help us in relieving the eyes when using tablets or smartphones. Of course, I will encourage you to blink more while using these electronic devices. But if you still feel uncomfortable, you may use these products to help relieve the symptoms. And as you mentioned, the issue of myopia, especially due to the pandemic, everybody tends to stay at home, especially for children, students. They have to study from home. So their time of staring at computers or laptops have become longer. So they stare at these screens from a short distance and for a long time. And they're not able to engage in outdoor activities during the pandemic. As we all know, if we do not engage in outdoor activities and stare at these screens for a long time, it could easily cause myopia. If it's not severe, it would not cause a big problem. However, for severe myopia, they may have additional symptoms like glaucoma, cataract, or other retinopathy. So a lot of the parents are very concerned about controlling the issue of myopia. For children with myopia, we want to help them maintain the symptom and not to degrade into severe myopia. In addition to the so-called 20-20-20, that is, rest for 20 seconds after staring at the screen for 20 minutes and looking at a distance over 20 meters. In addition to that, there are some medicine that can help you control myopia. For example, atropine, mydriatics. These products or medicine can help control the symptoms of myopia. And as James mentioned, people are concerned whether there are any side effects. So far, we haven't identified any severe side effects or problems. However, in the past, the concentration of these mydriatics were higher. But now, with lower concentration of mydriatics, they are still effective, but it will not cause much side effects. And for children, they would not be afraid of lights. So at this moment, in addition to the mydriatics, to have an eye examination on a regular basis is also a very good way to control or prevent myopia. If that is not enough, actually in Taiwan, we also have the ortho care contact lenses. The benefit of that is that it will not cause the problem of being afraid of lights. And when you wear that at night, kids do not need to wear glasses during daytime. My kids wear these ortho care during nighttime as well. If we follow the doctor's prescription and clean these contact lenses and wear them according to directions, these are actually quite safe. In addition to that, if you already have myopia, for example, some young professionals, they probably do not want to wear glasses for better styling, so they tend to wear contact lenses, or they may want to do some laser surgery to get rid of the glasses so that they have less problems in their daily lives. But some said if the myopia is severe to a certain level, laser surgery would not be appropriate. Is that right? Yes, that really depends on the thickness of the cornea of the patients. Because for laser surgery, it will cut on the cornea of our eyes. So if the thickness of cornea is not thick enough, they may have some side effects. So you need to have professional doctors to evaluate your situation. For example, if you have any eye diseases or problems, you may not be able to perform or receive laser surgery. Yes, so we talk about children and adolescents. Actually, for people of our age, we are gradually reaching the age of having a need to take care of our eyes. I've heard that elders should pay special attention to cataracts, glaucoma, and age-related macular degeneration. So I have this card data here. It said that cataract is the biggest cause of blindness in the world. And there's some audience online also asked that the eyes feel there is a thin layer of white mist, as if the glasses are not wiped clean, and drip in front with the eyeballs. Is that a cataract symptom? Doctor, I know you're an expert in this area, and you perform cataract surgery for more than 10,000 cases, which is truly amazing. Can you help us explain how to prevent cataracts? Is it possible to prevent cataracts by wearing sunglasses during daytime? And is it possible to control cataracts in the early stages by other means than surgery, for example, using eye drops? Thank you, James, for the question. Due to the aging population, and Taiwan is regarded as a developed country, so we are facing the challenges of an aging society as well. The cause of cataract is, of course, the age. So people over 50 will have a higher probability to have cataract. Of course, there are younger people due to medicine or injury causing cataract as well. So if cataract is formed, there's no medicine, there's no way for us to use medication to get rid or delay the symptoms of cataract. So currently, surgery is the main solution for cataracts. So as James mentioned, wearing sunglasses, is it possible to prevent cataract? I think it will help more or less, because if you're exposed to strong lights for a long time, you will certainly damage the health of your eyes. The cataracts will cover our eyeballs, and the crystalline lens, if it gets blurred, it will become what we refer as cataract. So mainly we use surgery to get rid of the problem. And cataract surgery is probably the most practiced surgeries around the world. And technologies and treatment has been really advanced at this moment. I think there are many doctors who have performed more than 10,000 cases or surgeries in Taiwan. And in the process, we need to use some materials or devices to make the surgery safer. So during the surgery, in order to maintain the stability of our eyeball, we will use the IOL. In the process, so that is the product produced by local manufacturers, local vendors. So we'll be able to use surgery to remove the blurred crystalline lens. We'll be able to use the IOL to replace it. For IOL nowadays, it's in a folded form, so the cut will be really small. And so after the surgery, you will have less side effects compared with the past. So these techniques is actually a patented skills or techniques owned by a local vendor. And they also have the ability to produce IOL, which we use for our patients. For patients with cataract, with these techniques and these IOLs, they'll be able to recover their eyesight. There are many types of these lenses. Many of these patients will not need to wear glasses after the surgery. It will also solve the problem of other side effects. So if your symptom of cataract has reached the status of needing surgery, I would suggest you to be evaluated by professional doctors before you perform the surgery.
So another serious problem is macular degeneration, and everyone's concerned with it. Are there any simpler ways for us to see if we have early signs of macular degeneration? Yes, thank you, James, for raising this question. This is very important. Whether it's our eyes or other organs or functions, we need to constantly self-evaluate. Especially our eyes. It's very important. Every morning when you wake up, just open one eye and close the other to see if there's any difference. It's an easy way for you to detect whether there's issues with your eyes. So for macular degeneration detection, I think we can carry out vision examination. So usually you need a certain distance for us to carry out eye examination. So let me do this. Can you see this? You need to close one eye and open the other. I think in the middle row, I can see the bottom line. But the numbers are quite blurry. I think our chairman has quite a good eyesight. So these are easy ways for us to check our eye health. So sometimes when you hang a calendar on the wall, you can use that as well. Of course, for the macular degeneration, sometimes you see deformed objects, or you see weird colors. So here I have the Amsler grid. You can check if you see these grids, whether they are deformed or not. So obviously James has good eye health. So we can use our wall tiles, or when you are playing chess or checker with your friend, you can use the checkerboard. Just close one eye and open the other to see if there's any difference. And if you notice anything, you need to seek the help of a doctor for a thorough examination and inspection to see whether it's treatable. And another question for Dr. Lai is that in our daily life, we are more westernized, so we have more people with diabetes. And I heard that diabetes will cause some complications when it comes to retinopathy. And I see a data that by 2050, there will be over 15 million people with diabetic retinopathy. Why does diabetes cause retinopathy, and what are the treatments and products in this area? So just like Jim said, because of our diet and of our environment, because people are getting wealthier and obviously we eat a lot more things, so obesity and diabetes are two major problems in the world now. And because diabetes will affect our blood vessel, and because there are lots of blood vessels in our eyes, and it will affect the cells. For example, bleeding or congestion of our blood cells. And that will cause bleeding of retina or macular bleeding. So for diabetes, first of all, we need to control the blood sugar or the fat and your blood pressure and so on. And if you control all these three, it will help you to prevent some of the eye issues. And obviously, diabetic patients are usually in middle age, so they have to work to support their family. So obviously, blood sugar is very important. They need to go see a doctor to see if there's any problem caused by blood pressure and blood sugar. And these are all treatable. So if there's retinopathy or bleeding of the lens or glaucoma in the severe cases, and so we need to prevent these severe cases, diabetes-related issues, or the retinal detachment. So we need to have a retinal laser to prevent these problems, to maintain their eyesight. These are important tools. So sometimes we need to use these laser treatments or these devices. This is one developed by our local vendor. So we can use this to prevent blindness. So if you have diabetes, whether it's inherited, you need to go see an eye doctor as well. And if there are any problems, you need to seek professional treatment to prevent blindness. This is very important. And thank you, James, for raising this question. Okay, so thank you, Dr. Lai. These are very important information. Another thing I want to ask, because for people older than middle age, they are worried about floaters. Because sometimes when I see things, when I look at things, I feel like there are things flying in front of me, from left to right or from right to left. Sometimes my eyes feel very dry, so I use some of the off-the-shelf products, for example, like hot patch eye mask. Are these related to fatigue or overusing our eyes? Or because we have longer screen time, whether you're in office or at home or you're riding the MRT or the train, will it deteriorate your eye health or make floaters more serious? There are two kinds of floaters. There are good floaters and bad floaters. Some floaters are physiological floaters. For example, when you grow up within your lens, when you in the viscous, you have some viscosity, and that will cause floaters. And the other is age-related. As you grow, obviously your organs, they degenerate, and your protein becomes opaque. And when you have these opaque protein in your lens, you have floaters. But some floaters are pathological. For example, you have bleeding in your eyes, you have inflammation, they will see floaters as well. And these are pathological, and you need to go to see a doctor as soon as possible. And there's another kind of floater in between the two. So when you grow older, your lens degenerates, and to a certain extent, it detaches from your retina, and it will rip open your retina, or it will cause retinal detachment. And so I want to remind everyone to pay attention to this. So if you had never seen floaters before, and all of a sudden you see a lot of floaters, please go see a doctor to see if you have any of these problems, for example, retinal detachment and so on. And then we can treat these problems. We have preventive treatment using laser to slow down the degeneration or to prevent blindness or retinal detachment. So this is very important as well. So I mentioned pathological floaters. It's very serious. It's not just some flies. You see lots of floaters in front of you, or like fog, or you have deteriorated eyesight, headache, or pain around the eyes, in the eyes. So if you have these problems, please seek professional help. And James also mentioned we have longer screen times nowadays, and we stress our eyes. Would it cause the floaters to increase? But I think clinically we haven't found any proof that these two are correlated. But when you go to a brighter place, you see more floaters. And if you go out at night, you don't see as many. I think for these physiological floaters, some people will wear a certain kind of glasses. And obviously, if you are always staring at your screens, and sometimes you look at it from a very short distance, it's almost like shining a flashlight into your eyes. So this is not good. And whether or not it will increase the number of floaters, obviously, I think you still need to follow the 20-20-20 rule I mentioned to protect your eyes. Okay, Dr. Lai, can you remind us again the 20-20-20 rule because it's so important? Okay, 20-20-20. So last year it was year 2020. So throughout the world in the ophthalmological world, we wanted to promote this 20-20-20 rule for eye health. So when you use your eyes for 20 minutes, you take a break for 20 seconds, at least 20 seconds. And what do you mean by resting your eyes? You look away, you look into the distance, beyond 20 meters. When you rest your eyes, you simply look far away. That's called resting your eyes. So 20-20-20, 20 minutes for 20 seconds, 20 meters away. That's the very simple rule. Okay, so 20 minutes, 20 seconds, 20 meters, or 20 feet. Okay, because of the COVID-19 pandemic, people have less opportunity to meet eye to eye, and it also facilitates the development of remote medical services. And we've seen a lot of the international online platforms creating lots of the contactless business opportunities. But my question is, sometimes we need to go to see an eye doctor to examine our eyes. But with the ongoing pandemic, do we have a way to remotely inspect our eyes? Do we have any devices for us to inspect our eyes for eye examination and diagnosis? Yes, during the pandemic, lots of the patients, they are afraid to visit a doctor in the clinics. And for some disease, obviously it's not that big a problem, but for some other disease, for example, macular degeneration or retinopathy or some other disease, you need to visit the doctor regularly in order to treat your problem. And because of the pandemic, so around the world, we see a lot of, for example, age-related macular degeneration or myopic macular degeneration. A lot of people are afraid to return to check for follow-up, and that caused a lot of problem, and a lot of people lost their eyesight consequently. So that's very unfortunate. So right now, the remote medicine is very helpful during this time of pandemic, and our government has also done a lot of promotions, and we also to help people living in remote areas or the outlying islands to provide them the professional medical services they need. Right now we have the portable digital 5MP eye fundus camera. So you can take images of your eye fundus. You don't necessarily need a professional doctor. You just need to go to a public health center for remote area residents. We have these easy-to-operate devices. We can take a picture and then digitally transmit it to a doctor, to a ophthalmologist, to see if they have macular degeneration or other problems, or do they require immediate immediate treatment. So this is very helpful for people living in remote areas, and we can timely evaluate whether they need immediate treatment or medical intervention, and they won't be affected by the pandemic or social distancing rules. And in addition to these remote methods, because of the pandemic, we also facilitated lots of AI-assisted treatments, because we can use AI to carry out diagnosis on the images, and this actually lessens our burden a lot. So in addition to remote medical services, we also have AI-assisted treatment, and this is really helpful to the treatment and diagnosis of eye disease.
Okay, thank you. We know that you are now an international well-known doctor. You have helped more than 10,000 people to regain their eyesight, especially for high myopia macular degeneration surgery. And you also created an original endophthalmoscope transplantation autologous blood repair. The success rate is close to 100%. Many foreign patients also come to Taiwan to receive these surgery from you specifically. Could you please talk about why foreign patients choose to come to Taiwan to have these treatment or surgeries? Firstly, we need to thank our health insurance system. We have wonderful health insurance system here in Taiwan to ensure the health of our public, because the cost for treatment is inexpensive, so patients do not need to worry about not being able to afford these complicated surgeries. So a lot of patients in other countries, these surgeries may cost a lot, but due to the national health insurance, doctors will feel comfortable to perform these complicated surgeries and do not have to worry about whether the patients can afford the cost. So this is the advantage that we have in Taiwan. That's why doctors in Taiwan have more experiences, because they get a chance to perform more surgeries of this kind. For other countries, due to financial concerns, they may not be willing to perform these kind of surgeries. So due to these reasons, we have a lot of experienced physicians and doctors here in Taiwan. And as James mentioned, we have a huge population of patients with myopia. And also, as you mentioned, severe myopia may also cause macular degeneration. People in their 50s or 60s, they may have these kind of macular degeneration or detachment. This is something that cannot be resolved through medical treatment. So about 10 years ago, the surgery success rate was really low. If we want to help solve the problem and improve the eyesight, the success rate was 40% 10 years ago. But now, with more innovative treatment and surgery, we're able to improve the treatment, and the success rate is now very close to 100%. Of course, when we publish these treatment in 2015, these kind of skills and techniques has been further improved by other professionals in other countries. There were a Canadian doctor came to Taiwan to receive the surgery and have very successful results. In many countries, like in the United States, their doctors may not have that many experiences because they do not have that many myopia patients in the United States. So in my case, you can see that not just for ophthalmologists, in other departments such as plastic surgery, whether for treatment or surgery techniques, we are as good as, if not better than, the level or standard of foreign countries. All of these equipments are of the same quality or are updated as in other advanced countries. Secondly, our physicians, we use English textbooks, so we're able to communicate with patients in either English or Mandarin. So these also help to receive more foreign patients to come to Taiwan, because we provide a very patient-friendly environment, and the expense is also moderate compared with many other countries. The cost of these surgeries are only half or one-third of that of other countries. I remember before 2019, I think there are close to 400,000 patients coming to Taiwan for treatment or surgeries per year. Chang Gung Memorial Hospital also receive a lot of these patients. And in the future, I think that if there are foreign patients, foreign citizens who need these treatments, I think we can help. Taiwan can help to provide these surgeries and environment for them. Some of my patients came to Taiwan for treatment because in concern of privacy, because in other countries for some treatments they don't want their relatives or friends to worry about them, so they come to Taiwan for the treatment and they will go back to their country safe and sound. So maybe they don't want to expose their conditions to too many people. So in addition to the technical and price advantage, if you want to come here to treat the diseases or symptoms while touring the country, which is also a very good option. Yes, Taiwan actually has a lot of advantages in terms of international surgeries or treatments. Not just in Asia, we are truly advanced in the world. During the past 10 years, Taitra has been working with the medical community to export these outstanding technologies and techniques to other countries and to contribute to the local medical community. As an expert in your professional area, I think many of the audience are really curious about how you protect your eyes. Are there any tips? And if we have some eye diseases, what foods can we take to help our eyes to repair and regain health? Please do share your tips with us. Yes, I'm a little embarrassed talking about these questions because we also have myopia. As an ophthalmologist, we also have myopia. But your eyes is a part of your body, so you need to have physical and mental health. As I mentioned, there are some diseases that are related to our eyes. Hypertension, diabetes may damage our eyesight. So first, you need to maintain the overall health of your body. You need to control your cholesterol level, blood sugar, blood lipid, and so on, or avoid obesity. Secondly, do not take medicine randomly, because some medicine may cause cataract or other eye problems or symptoms, especially steroids. If you do not know the ingredient, make sure you have experts or medical professionals to check before you take them. And also, as I've mentioned, do the 20-20-20. Do not stare at one point for too long a time. Do not overuse your eyes. I think this is very important. Number 4, do some self-examination on a regular basis. For example, when you wake up, when you need to check your eyes by opening only one eye, and to use these tools that I just demoed to see if there's any defects in your eyesight. If you see any problem, go to the doctors immediately. Please do not delay. In my clinic, some patients that actually was not aware of their eye problems and delayed the treatment, which caused the symptoms to get worse. As for food or supplements, I would suggest having a balanced diet, balanced nutrition. I think many food already have very good lutein contents. For example, dark green vegetables, spinach, or egg yolk. And if you already have macular degeneration, if you want to take supplements, lutein, we will not say against that, but only by consuming food or supplements is not enough. You need to have proper nutrition, regular exercise, good sleep. These will all protect your eyes. Okay, within a very short dialogue, Dr. Lai has talked about all these tips and information regarding eye health. We have a lot of questions online to see whether we can have Dr. Lai to answer these questions. Number 1, this question is from Ms. Xu. Can someone who has undergone myopia laser surgery have presbyopic laser surgery again? Is there any risk to do this surgery twice? Yes, you can. Laser myopia surgery has been quite popular during the past 20 years. If you perform laser surgery 20 years ago, you probably now have presbyotic issues. Right now, yes, you can do it twice. When treating myopia, you may also perform myopia laser surgery twice, if necessary. For presbyotic laser surgery, we haven't had a lot of clinical statistics to answer these questions definitely. However, laser surgery, one important determines is the thickness of your cornea, because you still need to cut your cornea when performing these surgeries. So if you do not have, if your cornea is not thick enough, there may be some side effects. And some people who already perform laser surgery, the structure of their cornea has already changed. So it's difficult to predict whether they're able to perform another laser surgery. But I think we need to evaluate the case one by one. In some cases, I think it's doable. Okay, next question from Mr. Zheng. My left eye has undergone retinal detachment surgery twice. What kind of maintenance do I need? For eye protection, number 1, you need to take good care of the other eye and have examination to see if you can do some preventive treatment. Secondly, if you have retinal detachment, try not to rub your eyes or being hit. You need to follow the principles of self-examination. As I mentioned earlier, if there's any problem or symptoms, please go to the eye clinic immediately. And in Taiwan, actually, we have good techniques, and we have easy access to medical resources. And for most cases, it's not that difficult to be treated. Try not to have your eye hit or touched. If you already have retinal detachment, for example, you shouldn't involve in sports like basketball or rugby. You can have exercises with less contact, such as swimming, tennis, badminton, and so on. So you need to take good care of your eyes in your daily life, do self-examination, and a regular checkup. Next question from Ms. Chen.
So how do we deal with aging of our eyes? How do we take care of our eyes? I think Dr. Lai already mentioned some tips, but can you respond to this issue again? Because obviously aging is a natural process. It's not just the aging of our eyes. I think aging is a process that affects your entire body. And all we can do is to delay or slow down aging. Right now, the medical science cannot reverse or prevent aging. So all we can do is to slow the process down. And so, as I mentioned, how you take care of your body, exercise, sleep, take care of your eyes, wear sunglasses for protection. And if you have any problems and issues, please go see a doctor. I think if you follow these rule of thumbs, it's going to slow down the aging process. Another question: how do we take care of eyes after undergoing cataract surgery? I think all surgeries, obviously, we worry about infection and bleeding. So if 2 weeks after your surgery, you need to pay attention to avoid contact and prevent infection, because you need to clean your wound, and once you are healed, so once your wound is healed, then you can have water or other liquid in your eyes. So I think prevention of infection is very important after surgery. Try not to go to a very dusty place. And usually within a month, I think everyone can gain full recovery. We have another question very much concerned by parents and office workers. The blue light of our screens. Every time, so when we go to get new glasses, prescription glasses, people ask for blue light prevention lenses. And obviously, if you have long exposure to blue light, it's going to harm your eyes. But if you use your devices following all the rules, it's not that serious a problem, because right now we don't have any clinical evidences. But when you overuse or overstress your eyes, obviously it's going to be harmful. But if you want to get these kind of glasses, we need more scientific proof that it prevents these problems. But it's not harmful to your eyes. Artificial eye drop, we have the preservatives. Some have preservatives, some don't. And is it okay for eye drops to have preservatives? And also for our universal insurance, they only prescribe artificial tear. They only prescribe ones with preservatives. Or obviously, when you have your own tear, you don't need artificial tear with preservatives. Because for those ones with preservatives, it won't get contaminated, and it's not as prone to infection. So obviously, early on, when you need artificial tear, you still have your own tear, and the doctor will prescribe artificial tear with preservatives. But if your problem is more serious and the doctor prescribes artificial tear without preservative, because otherwise there's going to be residual in your eyes because you don't have your own tear to wash it away. But that's not covered in the universal insurance. You need to pay for that. And also, I think if you have any problems, stop using the artificial eye drops or tears with preservatives. But with doctor's recommendation and direction, you can use either one. Obviously, this is a problem many people are concerned with because people are afraid of preservative. Okay, so we have another question. A friend underwent retinal detachment surgery. What caused this problem, and how can we prevent this problem? Retinal detachment is mainly caused by 3 reasons. So we have tear, or there are different kinds, whether it's being torn off or there's a hole in your retina. And as I mentioned, because of our problem with our lens or with your injury, it will cause the retinal detachment. And another one is pathology. You can see floaters. So it's like sand. It's not just a few. You see a lot of floaters. And if you have signs like this, you need to go see a doctor as soon as possible. And obviously, it's degeneration of lens. So how can you prevent that? Because you have family members with this problem, or you have one eye with retinal detachment, you need to inspect the other one and take care of the other one. And sometimes when you have very thin retina, or your hole is very little, we can use laser to fix your retina. And so you have a scar. Basically, it scars your retina so that it hold on to your lens and you won't have retinal detachment. So when we go to see an eye doctor, we'll inspect whether you have a hole on your retina. And once you use laser treatment, the effectiveness is over 95%. So obviously it's not going to be 100%. But I think if you have the history in your family, or you have injury before, or you are over the age of 40, you need to go have your eye fundus examined once a year and to prevent and to identify some of the factors. Obviously, we have a lot of more questions. But because of time constraint, we only have time for one last question. Okay, so this, according to this audience member, he has suffered from seeing floaters since he was very little. Can he fix this problem by surgery? Because usually floaters only happen to people at an older age. Well, we don't recommend people treating floater through surgery because some people, they have a lot of floaters and they have blurry vision, and in some cases because of their profession they need to undergo surgery to fix the problem. But usually if this person's eyes are healthy, and if the floaters, it doesn't bother you or affect your daily life, we don't recommend surgery. Because for some people, they just look away, the floater floats away. But I have this patient. He has a lot of floaters, and sometimes at night it affects. Because he's a taxi driver, it affects him when he's driving. So he needed treatment. So usually we don't recommend you to go under the knife if you can live with this problem. Because after all surgeries are risky. We still have more questions, and we still have a few minutes, so is it okay if you answer 1 or 2 questions for us? Okay, so this question. This person has myopia presbyopia, and they have the 550 degrees and 575 degrees. Do you recommend surgery? Actually, I need to see this person. We need to also take into consideration of the person's age. First of all, if this person is very young, only in the early 20s, and the cornea conditions are well, and he doesn't want to wear glasses, then obviously he can try LASIK or the laser myopic surgery. So you need to meet all the criteria. But if this person is over the age of 50 and this problem is caused by cataract, then you can go under a knife to treat your cataract. And obviously, we have the IOL for us to treat these aging and problems. Then there are certain criteria you need to meet, and we need professional doctor's judgment. And if you are not suitable, then obviously you can wear glasses or wear contact lenses for correction. So it all depends on that person. Because I have some patients, they know they don't prefer wearing glasses. They work. It's hard for them to put on glasses. It's hard for them to wear contact lenses because they work on an airplane with long flying times. So if these problems affect their everyday life, affect their profession and job, then we will evaluate and we will find the least risky way to treat their problem. Okay, so you mentioned the artificial tear with preservatives and without preservatives. So we have another question. Can you use artificial tear for an extended long period of time? Actually, artificial tear is a very safe supplement. It helps to moisten your eyes. So I think long-term use is not really a problem unless you're allergic to some of the preservatives or some of the ingredients. I mean, in very few cases. But other than that, for me, even myself, I use it long term. Okay, so this is very important. I think for a lot of our audience member, it's good news to hear that they can use artificial tear long time. Okay, last question. So I think this question is quite interesting. If this person, when he was young, he had the 500 degrees of myopia, and then he grows up, and now he has 200 degrees of presbyopia, and does it mean that he only have to wear a 300-degree prescription glasses? So you simply take 200 off the 500, right? Actually, yes, myopia and the presbyopia they cancel out in a way. But obviously, we have the multifocal glasses and so on. So again, I recommend you to see a professional, whether it's eye examination or to get a pair of prescription glasses or reading glasses. You don't just buy it off the shelf. I know a lot of people do that, but I still recommend you to seek the advice of a professional. Okay, so today we actually learned a lot about our eyes and eye health. I think our audience online, just like us here, feels that 1 hour is too short, especially with Dr. Lai, with his extensive experience in ophthalmology and treatment. I think we were very thankful for him to share with us. And obviously, as I mentioned, we have good medical services in Taiwan. We have good medical technologies in Taiwan. And a lot of hospitals in Taiwan, we have the online diagnosis or online clinical visits. So if you are interested, scan the QR code at the end of our session. You can contact us. We can make arrangement for you to see a doctor remotely in Taiwan. Once again, thank you, Dr. Lai, for sharing with us. And I would like to wish all of you in front of the screen a good eye health and good life. Thank you. I'll see you next time on James on Air. Thank you. Thank you, Dr. Lai. Thank you. Thank you, James.